184 Sembabule or 0700 577 241 Chigangazi. At Maogola Farmers, we serve when you are sick, you need a good ambience to pick your medicines. Maogola Farmers is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Farmers, we serve with care. When you are sick,
okay, we start. Okay, good evening colleagues. Welcome to Ask Dr. UTHUMAN YouTube channel and our TikTok live. Today is it's the 18th day of April 2024. Welcome to our live today, and as usual, we are going to be answering your questions, and today we have only 1 hour. We are going to utilize only 60 minutes for our live. So bring in your questions, and this time we are not going to waste any time. We're not wasting any time. We are only answering your questions. So I would like to implore you, for those of you who would like to have a private chat or to have a private conversation with me, just go to my website and book an appointment. That is www.druthman.com. You can book an appointment, and then we can share from there. But those of you who don't mind asking questions here, you can start asking your questions, and then I will be answering them live. And those of you who have not yet subscribed to our channel, please do not forget to subscribe, and also press the notification bell in order to be notified of any video we upload. So straight away, let's go to the first person to ask a question. This is we have Emilia Sega is saying, hi doctor, I think it's still greeting. Cynthia Obi is saying, can I take Clomid to boost my ovulation? Yes, Clomid can be used to boost ovulation actually, because Clomid, any medicine containing clomiphene is contains a hormone called LH, FSH, and you realize that it's LH, luteinizing hormone, that is responsible for stimulating or causing ovulation. Okay, ovulation, and we said that ovulation is the movement of the egg from the ovaries, where the eggs are manufactured, to the fallopian tube where fertilization occurs. So a drug like clomiphene or Clomid can help to stimulate or to increase the levels of LH, and so when there is a surge in LH, then ovulation will happen. So it is true, you are right, that Clomid can help to boost ovulation. Then another person is saying, Nachin to Aisha is saying, good evening to you. Tiffany, hi. Elsie, hello doctor, hello. Okay, I think all these ones are still greeting. Ben Starring, doctor, I'm from Nairobi. Say hi to those people in Nairobi and Kenya. Tawusi Nangu saying, hello doctor, how much money for hormone checkup? How much money for hormone checkup? It depends on the country where you are and which hormones you want to test. So I can't tell you the price, but it depends. And even the hospitals, different hospitals differ. You'll find that our facility charges this amount, but other facilities charges such and such an amount. And also it depends on the region where you are. So I may not be in position to explain to you or to tell you how much those tests cost. Then Irene Munguchiyo is saying, hi doctor, good evening sir. I took Clomid first cycle and I didn't conceive, and now I'm on second cycle, day 3 today. Is there a possibility I will conceive? I don't know, because you see, you're asking me whether you will conceive, yet I don't know your fertility strength. Okay, I don't know whether, because by the way, the problem is that some of you take Clomid when it's not the medicine you need. Someone has blocked tubes, but they want to take Clomid for what? Some of you are taking Clomid for nothing. You are supposed to take a drug because it's what you need. Okay, so you don't just take the drug anyhow. So taking Clomid, we should be sure that the problem you have is maybe you have low levels of LH or FSH. That's when you can take Clomid. So you don't just take Clomid, you take it for a purpose. So I don't know whether the reason as to why you're taking Clomid is right, and therefore I cannot predict whether it will really work for you. Then we have Christine Kangeni saying, hi doctor, between Clomid and Litrazole, which one is better for someone struggling to get pregnant? You see, if you look at clomiphene and Litrazole is stronger than clomiphene. But the problem is that, are you using the drug for the purpose required? For the right purpose? Because you are failing to get pregnant, I don't know whether the reason as to why you're failing to get pregnant is because you have low levels of LH. You may be having another problem, and for you just taking medicines. I have already said it here that taking medicines when you've not done tests to identify what the cause is it's as if you're doing nothing. Because you'll be taking a medicine which you're not supposed to take. You're taking medicine A, yet you're supposed to be on medicine B. I've seen many women taking clomiphene when they have blocked tubes. What will you conceive? No, there is no way you can conceive when you have blocked tubes. Even if you take thousands of tins of clomiphene or Litrazole. So the issue is we should first identify the problem and then treat it. So if the problem is LH, if your luteinizing hormone is low, then clomiphene or Litrazole will work for you. But as per the question you've asked, Litrazole is stronger than clomiphene. Then we have Nachin to Aisha saying, doctor, I am 3 months pregnant, but sometimes I have no symptoms in the stomach. Feels good. Nachin, congratulations to you, and this Nachin is our usual follower on YouTube. Congratulations to you. Feeling no signs of pregnancy is sometimes normal. It's only that every time a woman will have those signs of pregnancy, and again the pregnancy is still low, it's still young, 3 months. But if you want to confirm whether really the pregnancy is okay, just you can do an ultrasound scan to confirm whether you're fine or not. Then we have Namatovu. Nulian is saying, hello doctor, can you do IUI and how much money in your hospital? IUI can be done, but we cannot be on the channel and start discussing money issues, start talking about we can do this or such and such because of ethical considerations. Our role is to just teach the people to understand their health issues, to understand what they can do, but not to advertise, like coming here to tell you that I do at this and such an amount. Really, you won't find it with me. But what I can tell you is that IUI is possible. Then, Nachit Aisha, sometimes it feels bloated. Yeah, if it feels bloated, then you're likely to be having probably PUD or peptic ulcers. And ulcers also love to attack pregnant women. So you may be having PUD in pregnancy, and this is something which is simple that can be managed by your health caregiver. Then, okay, Tiffany Brown, what can I take for high prolactin? Different from cabergoline, it's not working. Bromocriptine is a substitute for cabergoline. Chichi saying, I had cysts. I took some herbs and went for an ultrasound scan. I was told that all is gone. When can I try a baby again? First of all, was it the cyst stopping you from conceiving? If it's the one, then you can conceive immediately. But if it wasn't the one, then you need to further investigate and find out what is causing that. What is causing the infertility? Sinom Chiria is saying, doctor, do you do culture and sensitivity of cystitis and can also cause rashes on the body? Yes, culture and sensitivity can be done in several hospitals. Even at our facility, it can be done. Doreen Tindimweba is saying, good evening, doctor. Is it normal for a baby bump to come out as early as what? As early as something is obstructing our question here. Can you read that question, that last question? As early as what? There is an icon which is obstructing me here. Check. Okay. Yeah, I've got it. Is it normal for a baby bump to come out as early as 3 months with a singleton pregnancy? Yes, it is. It is normal. It is normal, by the way, it is normal. Some women can have a bump as early as 2.5 months. So it's normal. It's normal, especially with big babies. It is normal. During you're pregnant, you conceived. If you did, congratulations to you. I know you also our usual viewer here. Tell us if you've conceived. We need to congratulate you. People need to give you congratulations here. Okay. Adaremi boss is saying, good evening, doctor. I don't know. I am having lower back pain and abdominal pain, left and right, and I just have my ovulation 7 days ago. I don't know what's wrong. I also don't know what's wrong, but it can be as an issue of hormonal fluctuations. But what I can implore you to do is to go and do a pelvic ultrasound scan to confirm that you do not have cysts, masses, PIDs, etc. Okay, this one is saying, doctor, I'm losing weight every day. I don't know why. I also don't know. Do tests. Find out, maybe you're not eating well. Are you eating well? Are you doing a balanced diet? Are you eating on time, in time? So you again, do tests. You may be having some disease which is eating you up. Or maybe you are stressed. All those things can cause weight loss. Yeah. Okay, some other questions. Good evening, Posh66 is saying, good evening, doctor. I had a blighted ovum, but I'm afraid, I'm afraid of conceiving again. How can you assist me? Just conceive. When you had a blighted ovum, there are very many chances that this time around, the baby will be fine. Hello, Eluwal. How are you and where are you calling from? Okay, I think the network is disappearing. Then this one is, she loves is saying, what causes tubes to block again after catheterization? The same problems that caused the blockade in the first case can still cause the blockade in the second case. 2, because for example, if you had a PID and you did not treat the PID, blockade can still come back. Secondly, most times, even after unblocking the tubes, those tubes remain like there is that laxity, and the tubes again can conjoin and block again. So, so issues to do with adhesions, issues to do with PIDs and cysts, issues to do with masses, all those ones can cause a blockade. Yeah. We have some other questions here. Okay. Number 12, doctor can enroll girl and block tubes. No, there is no girl, there is no medicine that can unblock tubes. Tubes can be unblocked by surgery, that is doing the catheterization, that is hydrosalpingolysis, that is laparoscopy opening. But medicines, herbs, and so on cannot open blocked tubes. I've seen many people saying, I have blocked tubes, and then someone was giving me herbs. They will not work. If you see, if a tube is blocked, you have to unblock it physically, either by performing an open surgery or by doing recatheterization through the vagina, or by doing a laparoscopic surgery. That's when you can open tubes, not using a gel, not using medicines. I think that is very clear. She loves. Okay, Aisha Halid is saying, I always lose my pregnancy when it gets to 2 weeks, and I have just lost it today. Sorry about that, Aisha. But there are many causes of early pregnancy losses, especially what we can now term as recurrent early pregnancy losses or recurrent miscarriages. But most of them are caused by chromosomal abnormalities. When there is an abnormality with your egg or an abnormality with the man's sperm, a pregnancy can be lost. 2, pregnancy can be lost when there is blood group incompatibility, the Rhesus factor incompatibility. For example, you as a woman, you are Rhesus factor negative and your man is Rhesus factor positive. You'll be having miscarriages. Another thing can be as a result of infections, but also do not forget that hormonal imbalance, especially women with low levels of progesterone, can have early pregnancy losses. Low levels of progesterone and those with high levels of prolactin. Also, women with low levels of HCG, human chorionic gonadotropin, those women with low levels of HCG can have early pregnancy losses. What I implore you to do is to go and carry out tests. Carry out tests to find out what is causing that, and then get treatment so that you can have more pregnancies. Then we live pregnancies and live babies. Chichi is saying, can O plus and O negative have children? Yes, you can have normal children, but this is what I said. With blood group Rhesus factor incompatibility, when one is negative and another one is positive, the first pregnancy will be okay. You don't have a problem with the first baby. Okay, the first baby is always okay. There is usually no problem. The problem comes with the second pregnancy. When you conceive the second pregnancy, it will have to be aborted. You lose the baby. Why? This is the reason. When a woman is Rhesus factor negative, the blood group is negative, and a man is positive, the sperm that comes from the woman, from the man, is positive, yet for a woman it's negative. Therefore, at first the body will not realize that, and the baby will grow. Okay, the baby will grow, the fetus will grow until delivery. But now, the woman's body, the woman's immune system will have understood that we've been invaded. We've been invaded. There are some aliens that have invaded us, and therefore we'll develop a strong immunity against those positive cells. Therefore, the moment you conceive the second baby and the baby comes with positive cells, Rhesus factor cells, the baby will be aborted immediately. And that's how women end up with recurrent miscarriages, because of Rhesus factor incompatibility. So having a different blood group, a Rhesus factor status from your man can pose a risk of recurrent miscarriages, and that's how women end up getting many abortions every time a woman conceives and loses the baby early. However, for the firstborn, everything will be fine. Then we have more questions here. Let me get more questions for you here. Okay. Emilia Sega is saying, please doctor, I have 28 cycle and this month I see it on 12. Please, when is my going to ovulation? All right, let's calculate it for you. If you have a 28-day cycle, if your cycle is 28 days, this is what you're supposed to do. Simple. It is simple. 28 days cycle. If it's a 28-day cycle, that means those of you who have been following me, you know this. Our L will be 28. Okay? So we want to find her ovulation day. Okay? We need to find her ovulation day. And you guys are going to help me. So we shall say 28 minus 14. 28 minus 18. So what is 28 minus 18? I need answers here. What is 28 minus 18? We want to calculate her ovulation day. What is 28 minus 18? 28 minus 18. Yes, I see answers have started flowing in. All right, yes. Everyone has the answer. This is easy. Okay, so thank you. It's 10, like you've said. Thank you so much for those of you who are answering. Okay, so it's 10. Then 10 plus 4. Who is getting it first? 10 plus 4. I think you know that formula. 10 plus 4. What do we get? 10 plus 4. 10 plus 4, 10 plus 4, 10 plus 4. Yes, people have it here. Thank you. People have it as 14. All right. So 14 plus 5, what do we get? 14 plus 5, what do we get? 14 plus 5. Okay, yes, people have it here. Thank you. People have it. Someone is giving us 10. Hey. Okay, all right, 19. Thank you. So 14 plus 5 is 19. Now, if your ovulation day will be on this day, that is the 14th day. This is the ovulation day. However, you are fertile from the 10th day up to the 19th day. So if you have sex on these days, you can conceive. So if you don't want to get pregnant, don't have sex on these days from the 10th up to the 19th day. So you are pregnant. You can get pregnant from the 10th day up to the 19th day. But 14th is the day you have very high chances of conceiving. The chances of conceiving are almost at 99%. So if you have sex on that day and you have a 28-day cycle, be rest assured that you are indeed going to conceive. Okay. Someone is saying Akajojo. Akajojo is saying, doctor, I have white milky discharges and smells like fish soup. Sorry. I have white discharges and smells like fish soup. How am I overcoming this? So sorry about that. Those discharges can really disturb women. And the problem is that every time a woman gets those discharges, they just tell you, I have an infection, give me medicines. I have an infection. People, when you have such a problem, make sure that you run your tests clearly. What I will tell you is that go and do what they call HVS before you take medicines, because you people rush. This this discharge is not going to kill you in seconds. So don't rush with medicines. First, go and run a test. Go and do an HVS. Let the laboratory do ground staining so that we can know which bacteria or which microorganism is affecting you. If possible, if the area where you are, you can do culture and sensitivity, let you do culture and sensitivity on those fluids. I sometimes receive women saying, I have discharges, I want medicines. When you tell them, let me check the discharges, let me look at the color, let me take a sample, they don't want. They're saying, doctor, you know me, I have infections. Just give me medicines. Personally, I won't give you medicines. Because these things are going to be recurrent. At the end of the, that's why most doctors will just do guesswork. I have a discharge, it's like, okay, take these medicines. Go and insert them down. Let us first do tests to find out what is causing this discharge. Of course, I know by talking about this fishy smell, it is likely to be chlamydia. But let's first isolate, let's first get the discharge, let's do the HVS, get the discharge, put it in under, view it under the microscope, identify which class of microorganisms are causing the infection, and then you get the right medicine. So that's the simple thing I can tell you. Make sure that you do an HVS, ground stain, you also do culture and sensitivity, identify the problem, get treated in. Okay, more questions here, we shall answer more here. Okay, which question is here? Okay, Sayedi Zuha Nagash is saying, good evening, Dr. Good evening. Can you please tell me the cause of IUFD and how can it be prevented for future pregnancies? IUFD, whoever is not understanding that, she's asking about intrauterine fetal death. What is an IUFD? What is intrauterine fetal death? Intrauterine fetal death is a condition whereby the baby dies when it is still in the womb. IUFD is quite different from a miscarriage or from an abortion. This is the issue. With an IUFD, the baby has already grown and the baby has reached what we call viability. With abortion or miscarriage, this happens before viability. What is viability? This is now another portion. Viability, we talk about viability when, for example, when you are pregnant and in case that baby is gotten out of your womb, it can survive. That means the baby is viable. But when the baby cannot survive, it is not viable. So if the baby dies before that time, it's an abortion or a miscarriage. If it's after that time, then we call that, we take that as an IUFD. Now, when the baby dies before, according most of the African countries consider 28 weeks. Okay, but in Europe you'll find that Europe considers 26 weeks, and in USA they consider 24 weeks. Now, wherever you are, if you're in Africa and those developing countries, and the baby dies before 28 weeks, that consider that as a miscarriage or an abortion. If you are in USA and the baby in the womb dies before 24 weeks, that is a miscarriage or an abortion. And in Europe, it's 26 weeks. Now, if the baby dies from the womb after 28 weeks or 24 or 26, like you understood, we call that IUFD, intrauterine fetal death. What can cause that? Number one can be a problem, maternal factors. When the mother is sick, the mother may be having diseases like syphilis, diseases like rubella. Infections can cause an IUFD. Two, poor feeding. When the mother is not feeding well, malnutrition. The mother is not feeding well and the baby is not being fed. Three, when the mother is anemic, the baby is not receiving enough blood. Four, bleeding. Issues to do with preeclampsia. Women with preeclampsia. It can cause that. Okay, preeclampsia of course doesn't cause bleeding, but when we talk about bleeding, we mean issues to do with placenta previa, issues to do with abrupto placenta, all those ones, trauma, all those ones can cause IUFD. Now, when you get an IUFD, after clearing everything, make sure that you go back to the hospital and find out what caused this so that you can avoid it in the next pregnancy. I may not tell you that yours happened because of ABC. Reason being, I don't know your history, and I've not examined you, and I've not done any test on you. But when you go to the hospital, it can be identified, and you avoid it next time. Okay, Anita Muinge is saying, what happens if you take Clomid and fail to have intimacy? Nothing happens. Nothing happens. Clomid, or Clomifene is not like Viagra. You know, someone came to the hospital, and I think he had taken Pedigra or Viagra, and then the woman did not come. And you know what can happen? Problems. So, but for Clomifene, this is different, and nothing can happen to you. Nothing. Okay. Emilia Saga said, please doctor, I have 28 cycles. I think for you I answered you. We said on the 14th day. So start calculating from the 14th day and from 12. Okay, calculate 14 days. So that day will be your ovulation day. Okay. As Isaac Ayera, doctor, my woman began her cycle on 15th this month. Again on 15th this month, she started menstruating. So what is the problem? What is the problem? Katwes Jemasi, does pregnancy help in conceiving faster? Does pregnancy care help in conceiving faster, and how long do I have to take it? This is a misnomer. These are just vitamins. Yeah, they can help a little bit, but you shouldn't really rely so much on them. Chichi, for how long can one take Overcare to see results? First of all, I don't even prescribe Overcare. Okay, Emilia Sang is saying thank you, God bless you, thank you too. Nama Tovunulian, what causes pelvic pain? Both in both sides. I know you mean both sides of the tummy. So, pelvic pain can be as a result of PID. Pelvic inflammatory disease can be as a result of cysts, can be a result of masses, when someone has masses or fibroids and so on. Cancers and so on, but mainly it's pelvic inflammatory disease. Mainly it's the cysts that cause pain. Dorin Tinumeva, good evening, doctor. Is it normal for a baby bump? I think I answered you. Aquare Njera, hello doctor. My sister's fallopian tubes were blocked during a cesarean operation. In case she wants to conceive, how possible can it be done? Let her unblock the fallopian tubes. The moment you unblock the fallopian tubes, you will conceive. When they're not blocked, you can't conceive normally. She's Fit is saying, hi doc, I have done LH, FSH, AMH, etc., but still waiting on the result. What are some of the problems that can be found with these tests? What do you mean? They can be found low. You may find that FSH is low or H is low. So they are either low or high. That is the problem you can find. Either low or high. That's what you can find. Okay, let's get other questions here. At the evening, Aminat is there any side effects if underarm implant expire and not remove? Number one is that the drug has expired, therefore it is no longer protective. So anytime you can conceive, that is the first thing. Then secondly, an implant itself, when it is in the body, it may not cause any effect, except if it was causing effects when it was even when it was not yet expired. But once it expires, even if you fail to get it out, no problem can happen to you. There is nothing that can, and you shouldn't worry. Doctor, I take clomifenes. This is who? Trinta baby. These people have names. Kesberg. I want to buy money. Kesberg for it.next. Check him out. Check out Kesberg from it's called it.next. That is your number one solution for information technology. Go to YouTube and search it.next. Please, after this live, even when we are still on live, check it.next on YouTube and subscribe to this gentleman. He's the man behind my camera. He makes sure that everything comes right. I hope everything is right. Yeah, the voice is okay. No one is complaining about the volume. I think the lighting is okay. The pictures are fine. Thank you so much, Kesbag of it.next. Please check out his YouTube channel so that you can learn a lot of things about IT. Let's continue with our questions. Doctor, I take clomiphene starting from 14 last month. It's now 8 days without my period, and I'm not pregnant. Yeah. So what's the problem? What are you asking? I don't know. Maybe you're asking that. Maybe you want to know why you took clomiphene and you're not pregnant. First of all, were you lacking clomiphene in the body? You see, I don't know. Anyway, I keep getting new people, but I find it hard, and I find a very big problem when someone takes clomiphene when they have not understood the problem that is caused, what is causing their delayed fertility. If you've taken long without conceiving, you are looking for a baby. 1 year, 3 years, 4 years, you're looking for a baby. Do not just go and take clomiphene. Don't. It's a misnomer. It's as if clomiphene is the one that can make someone pregnant. No. Before you do that, make sure that you've run tests and confirmed that you are lacking clomiphene. How can you confirm that you are lacking clomiphene? Do LH test, luteinizing hormone test. It will show you that you have low levels of LH, and if you have low levels of LH, of course you will not be able to ovulate, you will not be able to conceive, and therefore you can now take clomiphene. But you will be taking clomiphene when you even have enough LH. LH is enough, and you're taking clomiphene, it's now getting excessive. And remember, when there is excess of a certain hormone causes a reduction in one of the other hormones. And at the end of the day, people fail to conceive because they're taking clomiphene anyhow. So what do I advise? First, run tests. Confirm that it is what you need. Maybe you have masses, you may be having fibroids there, and for you just taking clomiphene, it will not help. Okay? It won't help. So first, run tests. Confirm what is disturbing you, and then you can now take the medicine. Okay, so we have another question here. Doreen Timumoya, if a lady with blood group, but Doreen, you've not told us whether you conceived. You asked something which was concerning a baby bump. Tell us if you conceived. I may not answer this question before you tell us. Let me first skip it. First tell us, Doreen. We need to congratulate you. She's fit. Can insomnia make it hard to conceive? No. Maybe some drugs that are taken because of insomnia can cause infertility, but funny time, how are you? Where are you calling from? And what is your problem? Fun time, we are with you. Ask your question and tell us your real name, where you're calling from, and ask your question very fast and loudly. Hello?
From Luwelo, I'm called Linda.
You're called Linda from Luwelo. What is the problem? What's your problem? How can we help you? How did you know that ligaments are paining you?
I'm feeling the pain.
So you're feeling the pain. Now, if you're feeling pain here, how do you know that it's the ligaments?
And the pelvic bone.
All right.
Right here.
All right. So I would request you to go and do a pelvic ultrasound scan. Is it the bone paining you, or just inside where there are muscles? Inside. Inside. So you do. That is likely to. Do you feel pain when you are having sex?
Not really, only that I'm pregnant.
You are so you mean pregnant women don't have sex?
I don't do it because I don't like the money.
You don't like the what?
I don't have appetite.
Appetite for what? For sex?
Yes.
How old is your pregnancy?
And the trimester.
Third,
Yes.
you need to have appetite. Do you know that sex is very, very nice during pregnancy, and especially when you're approaching labor in the third trimester?
But whenever I try, I don't have that appetite.
You try. You just. Is it because maybe you don't love the person you play sex with?
You know, like the moment I conceive, I just chuck him.
Oh, so when you conceive, you check him. Maybe you have sex with someone else.
Not really. Not really.
Because we need you to have anyway. What I'm saying is wrong. It's not advised to have sex with some other people when you're pregnant. You should have sex with only your husband. Anyway, just that you're not having sex, so it's not easy to understand whether you have dyspareunia. But if you had dyspareunia, that is pain during sex, then you would have confirmed that the problem is a PID. That is a clear diagnosis. So, but pain in that region can indicate a PID, pelvic inflammatory disease. It can also indicate cyst, okay? Presence of an ovarian cyst. However, don't forget that sometimes also the positioning of the baby, the fetal position, can cause that pain. Fetal position, so you may need to do an ultrasound scan to or focus on the fetal position, on the position of your baby, and also rule out cysts and pelvic inflammatory diseases.
All right, doctor, thank you.
Welcome. Is that all you wanted to know?
No, another thing is
Be fast.
more pain on the incision site.
You have you had a cesarean section.
Yes.
Yeah, pain on the incision site is expected when you are pregnant. It's as a result of pressure being exerted by the fundal pressure, the pressure being exerted by the baby onto the abdominal walls. So pain is expected, but it should not be too much. What you're supposed to do is take some painkillers.
Okay.
Yeah, there are some painkillers, and you can also take some gels. There are some gels. You smear them on the incision site.
Yes, that thing I have.
All right, Linda, have a nice time. I think that was your question.
And the back where they inject that injection, that hook, that spinal cord.
Yes.
Gives a lot of pain.
Yeah, that is expected. It is expected. All right, nice time. Have a lovely evening. Let's have some other person. Okay, this is Adeime. No, I answered this one. VEN, Chicken Queen. You people have names. Doctor, I want to book an appointment. It is okay, you book. Go to our website, you check it out. It's called, it's www. I hope you have it right. You go to Google and put this website, www.druthman.com. www.druthman.com. You can also check on our profile, on the profile here. That website is there. You can go there and book an appointment. Nanyonja 7 saying, Doctor, does HCG injection help in conceiving? Yeah, it does. It does. As long as the problem is known. You see, by the time we give HCG, it means we've done tests. Okay? Yeah, we've done tests and we've confirmed that you really need HCG supplement. Yeah, it can be given, but upon doing tests and confirming that you really need it. Chloe Nassani saying, can you text me? Oh, he's telling. Okay, all right. People are having their fun here. Okay, fine. Okay, let's have another question. Okay. What is the best medicine for coughing in children? I am sorry, I won't answer this email. I answer only fertility questions, questions regarding fertility, women problems, questions regarding I have failed to conceive, I have infections, and so on. So mine, I deal with fertility issues. Okay. Then this one is saying at Pink Panther here in UAE, they insert and get discharged. I was diagnosed acute candidiasis, but it keeps on. Here in UAE, they insert and get discharged. I don't know what are you trying to mean. What's the question? I'm not getting the question clearly. At Pink Panther, please ask the question clearly. Ask the question clearly. Okay. We have okay, questions are many here. Questions are many. Vivian Thomas. Okay, I answered you. Shukran Binti, I am menstruating, but I'm seeing light blood and the back is paining. Yeah, of course, back pain during menstruation. I said here that it's sometimes normal. It's as a result of hormonal fluctuations. So that is not a big issue. Yeah, you're saying you're seeing light blood. What do you mean by light blood? How many days have you seen blood? And what is the quantity? Can you fill up a pad in a day? Okay. Then Takorabi Barbara is saying, Doc, what causes yellow discharge? Most times it's the chlamydia that causes yellow discharge. Aquare Angela, we have ever had the word unblock as big as again you have said it is through operation or swallowing tablets. Aquera, we have ever had the word unblock as big as again you have said it is through operation or swallowing tablets. I have not really gotten your question, but what I can say, when you have blocked tubes, the solution of unblocking tubes is by doing an operation, open surgery. If it's not an open surgery, you do a laparoscopy. If you've not done that, then you can do transvaginal, you do what they call tubal catheterization, and some people do hydrosalpingolysis. Those are the only known methods of unblocking tubes, not tablets. Dr. Alex, this one, okay. Jennifer Ndigwe saying, good evening, doctor. Please, doctor, what is VIA cause CS stamps? Maybe you're talking about VIA. What I know VIA as a visual inspection via acetic acid. I don't know if it's what we mean, and that is one of the methods that can be used to test for, to screen for cervical cancer. Titus Chichi, can a woman that have adenomyosis have pregnancy? Yes, but that woman needs to be really assisted, because when you get adenomyosis, it becomes really hard for pregnancy to occur, but you can conceive. During Kemanzi, I also feel like vomiting, feeling weak. My back hurts. Can I have conceived during my periods? Yeah, there are women that conceive during periods. Actually, there are women that can conceive during periods. Check one of my videos on YouTube. Check that video. It is saying, can I conceive during periods? Check that video. It is there. I thoroughly explain how a woman can conceive during periods and how others cannot conceive when they are in their periods. I explained that question. Someone asked those questions. We answered very well. Check that video. It's on YouTube. It says, let me check, what is the title of this video? What's the title of that video? It is saying, let me get the title. Yes, can I get pregnant during periods? That is the title of that video. Can I get pregnant during my periods? Can I conceive 4 days? Can I conceive 4 days to my menses? 7 days before periods. That is the title. The title is saying, can I get pregnant during my periods? Comma, can I conceive 4 days to my menses? Comma, 7 days before periods. That is the title of that video. I repeat, check that video. It's saying, can I get pregnant during my periods? Can I conceive 4 days to my menses, safe days before periods. I answered that question clearly and you should go there, check. Dr. Alex is saying, tuned in, thanks for the service, welcome. Dr. Alex, where are you? Let me know you, Dr. Alex, where are you and who you are? Okay, and thanks for appreciating Dr. Alex. Then this one is saying, Agau Kuo Athian is saying, Doctor, I have been diagnosed with polycystic ovarian syndrome and doctor told me it will be hard for me to conceive and I have 3 months now. I'm 3 months now trying to conceive but failing. Doctor, what can I do to conceive? It is true what the doctor told you. It is very true that it will be hard for you to conceive. What can you do is to treat the ovarian, the polycystic ovarian syndrome. Treat the PCOS. Treat the PCOS and then get fertility drugs. Simple. Okay. Doctor, can I take clomiphene starting from 14 last month? It's now 8 days without my period. I think I answered this one. Is there any side effects? Okay, answered also. What causes brown discharge after ovulation? Hormonal fluctuations. So as a result of hormonal fluctuation. Esther Sharon, good day doctor. I have a galactoria and PCOS. What can I do? Treat the galactoria, treat the PCOS. So galactoria, it's breast milk discharge when you're not breastfeeding. That is galactoria. So, and in most cases, it's as a result of high levels of prolactin. So what you're going to do, take antiprolactin medicines like apacorin and bromocriptins of this world, because you use medicines like PCOS and Rimona. In other words, go to the hospital, treat the PCOS, treat the galactoria, you'll conceive. Doctor, this is called Shiravi. Doc, how can we book an appointment? I have said that go to my website, www.drkoofman.com, book an appointment, and you'll get me. Okay. Hi, sir, hi. Renavido, good evening, doctor, good evening to you. Muto Mutima winners, saying good evening, you people just, okay, greeting me. Let's go to the real questions there. Here. She's fit is saying, Doc, is there anything that help with low libido in women? Women these days want libido. Yes, there is something that can help with low libido. By the way, in most cases, there are men, I have said it here, and I repeat it. What causes a woman to lose libido? When a woman feels they don't want sex, there are mainly 2 things. Mainly 2 things. Mark this clearly. There are mainly 2 things that can make a woman fail to feel like they don't want to have sex, or that can make a woman lose libido. Number 1, it is stress, all psychological issues, all lack of interest in their partner. When a woman no longer feels you, and this happens, especially, let me tell you, you may be married, you have someone, or you have your boyfriend, and everything is okay, you really feel them. But the day you catch that man cheating, most of the women will lose their feelings. Even after forgiving, you say these women will tell you I've forgiven, but they don't forget. It's only us men that forgive and forget. We forgive and forget. But for a woman, yes, she will forgive you because naturally they are like that, soft. Okay, it's fine, okay, let's move on, it's okay, but please. But those people will never forget that. And at the end of the day, it is still, they keep it in their mind. Even when they are having sex, for them, their mind is telling them the other thing. So even when time comes and they really want to know to make you enjoy and so on, they'll feel like, so the libido will go away. So that can cause low libido. And another thing is as a result of low levels of estrogen, estradiol. If you have low levels of estrogen, feelings can go. And therefore, what you're supposed to do, find out whether it's not stress or it's not psychological. And I've always told women that if you have no feelings with your spouse and you want to confirm whether the problem is psychological or you have another problem, if you've not done this, you can try cheating. When you try cheating, you'll realize that as you plan to meet the other partner you're going to cheat with, even if fluids are already down, by the time the guy just touches, you're already releasing your fluids. And libido is high. So it will confirm to you that probably you have issues with the other woman. But of course I don't encourage that. But tests can be done. So estrogen, low levels of estrogen can also cause low libido. And when you take estrogen supplements, libido can go high. Okay. Negumbo is saying, is there any treatment for reversing menopause if a woman wants to conceive naturally? Yes. Menopause can be reversed and someone gets periods and then you conceive. Yes, that is something which is possible. It is possible. I can say it is possible. Tiffany Brown, hi doctor, I have high prolactin, empty serum. Question, do you think I can conceive and what is the best medication I can take? But I already answered you. I answered about high. I don't know, you're saying high prolactin, maybe you're asking something different. I don't know that. Empty serum, I don't know that you're asking. I really don't know. I'm not so sure. Tetas Chechi, doctor, what kind of medication does the woman that have adenomyosis need? It is surgery. But I would request you to first go for an assessment. Yeah, you need a clear assessment. The doctor needs to first do an assessment and then he gives you the right treatment or prescription. Because some require surgeries, by the way, actually most of them. Mentor Excel is saying, doctor, good day, please, how can I calculate irregular periods? What to do for my period to be regular? Now, you also, I will send you to my videos. Go to YouTube, check a video. There is a video. It's one of the videos I released a long time ago, I think like 2 years ago. One video is saying, mark the title so that you can look for it. It says, how to calculate my safe days, ovulation in irregular menstrual cycle. It is saying, check for that video on my channel. This channel you'll follow. It is saying how to calculate safe days, ovulation in irregular menstrual cycle, in irregular period, get pregnant. How to calculate safe days, ovulation in irregular menstrual cycle. That is the title of the video. So in that video, I described women of different menstrual length. If your cycle is 29 days, there are women who tell you, my periods keep on changing. This time I have 30 days, the other time I have 20, the other time I have... So that is the video which is talking about your ovulation. It says how to calculate safe days, ovulation in irregular menstrual cycle. Then, treatment of irregular periods. I also discussed that video, it is there. It is saying irregular periods, how to deal with irregular periods. How to deal with irregular periods, causes and treatment. I talked about that. Also check out that video. Okay, questions are many, but our time is up. Questions are many, but our time is up. I think this will be the last question. Doreen Kemanzi, doctor, I was operated and one tube was cut. Can I give birth to a boy or girl? I have only one sex. A woman does not, I repeat this, it is not the woman that determines the sex of the baby. It is the responsibility of the man to determine the baby's sex. Therefore, even if you have one tube, you can conceive and give birth to all genders. You can have a baby, a boy, you can also have a baby girl. So even if you have one tube, you can have all that. I think this is the very last one. Rahma, you know, sometimes I say it is the last and I feel sympathetic with some questions. Rahma is saying, doctor, I am 45 years, but still a problem for me to conceive, and I am not on my family planning method. Since over 10 years, I was using null plan. Now, 45 years you can still conceive. What you need to do is to go to the hospital, get tested, run different tests, find out what is lacking, what you're missing, you can still conceive. You can conceive. At 45, you can conceive. By the way, even when periods have stopped. It is very, very possible for you to conceive. For those of you who would like to have a private chat or a private conversation, because I know some of you really don't want to ask questions in public here, go to our website, that is www.druthman.com, and book an appointment. I'll be there and we chat. And also, those of you who would like to know issues concerning information technology, go to YouTube and check a channel. It's called it.next. It is being run by the man behind my camera here, and it's called Kesba. it.next is the channel which can give you important updates concerning information technology. You want to know how to install Windows. What's the latest video? Installing Windows 1. By the way, get this one clearly. Which video is there on your channel? it.next. Installing Windows 12. How, if you want to learn how you can install Windows 12, by the way, Windows 12. 11, Windows 11. Also, if you want to, there are some people, you want to hijack your woman's phone. You want to know what your woman discusses with other men. God should save me from that. But there are some men, there are some women who want to know what their spouses are discussing. You want to look your spouse's phone so that when they call her, you can get the copy of the conversation. But I do next, that is Kasbag, the man behind our camera here. God, give him a subscription and ask your questions. Thank you so much. Have a lovely evening. I sign out. Bye bye. Next time, we are meeting next week, Thursday, same time. Yeah. Sign out.
When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care. When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule.